My name is Vivian Onyejiaka. I'm a level 2 nursing student of MOMAC, and I have a doctor's order today for Mario, my senior. Mario, my senior, is diagnosed of pneumonia. There is Haldol, which is an antipsychotic neuropathic medication, and heparin, which is a blood thinner that prevents blood clots. So I'll be administering subcutaneous and intramuscular injection. So these are the injections. I have the injections, and I have my needles and my blunt needle for drawing the injection, the liquid. Then I have my 1 ml syringe. Then I have my 21 gauge 1.5 inch needle for the intramuscular. Then I have my 25 gauge by 5/8 needle for the subcutaneous. So then I also have my alcohol swabs for cleaning the equipment. So I'm going to start by sanitizing my hands. So I'm going to check that I'm giving to the right patient. So I'm going to confirm the injection with the right patient. So I will be sure I have the right patient, the right medication. Then I check the right dose. Then I check the route. Then I will check everything on the MRA to be sure I have everything correct. So I'm going to give first heparin, the blood thinner. I have doctor's order for 5,000 IUs, 5,000 units every 12 hours. So I'm going to be drawing that with the 1 ml syringe. So I'll prepare the injection right now. So I'm going to sanitize my hand again. So I have my 1 ml syringe and my blunt needle. And also I have my sharp container here by the side. So I have my needle and my syringe, but first of all, I'm going to clean the injection. So I'm going to wipe the injection. Then I'm going to put my needle. So I'm going to add I'm drawing 1 ml, so I'm going to put 1 ml air. I'm going to push it all the way back, then pull it so all the way. So I have my 1 ml. So I'm going to tap to be sure there are no bubbles. Okay, so there are no bubbles. So I'm going to lock back and then put this aside. So I'm going to now put my needle. So I'm going to switch my needle now from the blunt one to the 25 gauge 5/8 needle, and I'm going to label my medication, putting the patient's name and the right medication. So I'm going to set that aside. Then I'm going to sanitize my hand again. So I'm sanitizing my hand. I'm going to be wiping this is Haldol. I have the order for 1 milligram every 4 hours, or PRN, which is as needed. So I'm going to be drawing 0.5 ml with my 1 ml needle and my blunt needle, 1 ml syringe and my blunt needle. So I'm going to tap it to make sure everything is under. Then I'm going to break away. I'm going to be using the alcohol swab and break away from me. Then I put this in the sharp container. Then I'm going to be drawing. I'm going to put 0.5 ml air. Then I will put the air back inside then draw my 0.5. Okay, so I'm going to rock it back. Then I'm going to be changing the needle now to the 21 gauge needle, 1/2 inch. My patient is actually over 60 kg, so I'm going to be using the 1.5 inch needle, and I'm going to be labeling it. I'm going to be putting my patient's name and the medication name for safety. Hi, how are you?
I'm fine, thank you.
My name is Vivian. I'm a level 2 nursing student of MOMAC, and I'm here to administer doctors and injections according to doctor's order. Today I have an IM and IV. Can I get your name, please?
My name is Mario.
Okay, can I just please confirm your name? Mario, the date of birth, the MAR is the same thing. So I'm just going to confirm with the second one. So I have the right patient, the right dose, and the right medication. And I'm going to sanitize my hands once again. So I'm going to be administering the Haldol first. This is Haldol is antipsychotic, anti-neuropathic pain. It's used for neuropathic pain, and also it helps to stabilize the mood. It controls emotion. So I'm going to be administering it first. It's an intramuscular injection. So I'm going to now be confirming the site. So I'll be using the deltoid muscle. So I'm going to check from her acromion process. I'm going to go 2 to 3 centimeters down. So this is the site of injection. So I'm going to check for any tenderness. I'm going to palpate, checking for tenderness, and I'm going to be sure there are no injury at the site of injection. So everything seems okay. So I'm going to sanitize my hand again and put on my gloves. So do you have any questions so far? You have any question for me?
No.
Okay. So the injection is going to sting you. The needle will sting you a little bit, but that's not going to be too painful. So I'm going to be cleaning the site now. I'm cleaning from inside to outside. So I'm cleaning up to about 5 centimeters. So I am going to be administering the injection, going in 90 degrees. So when I go in, I'm going to aspirate to make sure there are no blood before giving the injection. So I'm going to go gently, gently, gently. Then I'm going to pull out my needle, put that in the sharp container needle. Then I'm going to just put a cotton across without pressing it hard. I'm going to put a tape. So, and I'm going to take off my gloves, and then so after taking off my gloves and putting them in the hazardous, I'm going to sanitize my hands once again. So I'm going to be administering the second injection. This is heparin. It's a blood thinner, so it helps to prevent blood clot. So, and then I'm going to check for the injection site. I'll be using her upper left abdomen. So I'm going to palpate for tenderness and make sure that is not a frequently used site and there are no injuries at this site. So no tenderness and everything is okay. So I'm going to sanitize once again, and I'm going to put on my gloves. Do you feel any pain from the previous injection?
No.
Are you feeling anything right now? Okay. So I'm going to clean the side from inside to outside. I'm going to do about 5 centimeters away from your level. So I'm going to be going 45. I'm going to clean from inside to outside. 5 centimeters away from her belly button. Then I'm going to allow it to dry, for the alcohol to dry a little bit. Then I'm going to go 45 degree while pinching her abdomen. I'm going to pinch, then I go 45. Then I am releasing my hand and I'm grabbing it. I'm doing it gently. I'm doing it. Let me know if you feel any burn or any pain. Gently, gently. Then I'm going to pull out the syringe gently. Then I put in the container. So I'm not going to rub or do anything. I'm just going to put the tape across without pressing it. So, and we are good. So I'm going to take off my gloves and put in the hazardous and sanitize again. So I'm going to come back in 15 minutes to make sure everything is okay. But meanwhile, if you feel any signs of allergy or anything, any headache, any pain, just use the call bell that is just right beside you. I'll come back in 15 minutes to make sure that you are okay. So yeah, so I have finished administering both injections, and I'm going to do my documentations right now. So everything went well, and I'm going to go back in 15 minutes to make sure my patient is doing very well, and that will be it.